If your doctor told you to rest until the pain goes away, they're only half right. Here's the thing that nobody tells you. For most people dealing with chronic pain, rest is not the answer, but neither is pushing and grinding out like the pain isn't there. I'm Nicole. I'm a doctor of physical therapy and an online fitness coach, and I work with people every day who are stuck in that in between. If you're scared to move because of pain, but also deep down knowing that doing nothing isn't working either, then this video is for you. We're going to talk about how to actually train sustainably when you're dealing with chronic pain. Not how to just survive and get through a workout pain-free, but how to build real lifelong sustainable strength. Now, when we're talking about chronic pain, there are two ways that I see people fail. And honestly, both of them make total sense given how some of us were brought up. The first person I see is the push through anything person. These are typically my ex-athletes, or if they had parents that were ex-athletes. I am guilty of this one. These are people who've been told by coaches or Instagram or their own stubbornness that
pain is weakness leaving the body, no pain, no gain.
Blah, blah, blah. We've all heard it. So those people end up training through the pain and almost ignoring it. And by doing that, they're either making it worse or they start to develop an underlying fear that movement is what is causing that pain. Because they are pushing the movement so hard and through the pain, they're starting to associate movement is causing the pain, which can make the pain worse. And we'll get into that in a second. The second type of person I see is the avoid everything type of person. These are people who got hurt or they went to their doctor and they were diagnosed with an injury and they decided that the safest thing to do would be not move. They stopped lifting, they stopped running, they stopped doing the things that they love. And I get it because that makes sense. If you have pain, then the way to heal that would be to rest. But what actually happens when you completely stop everything? You start to lose strength, you start to lose mobility, and your nervous system becomes more sensitized. With all that, the pain will actually end up getting worse, not better. So neither of those type of people are the answer to dealing with chronic pain. What I want to give you today is a third option, a better option, one that's grounded in actual physical therapy, movement-based science, and it works in the real world. Before we get into how, let's just go over chronic pain. What is chronic pain? Depending on where you look, the length of time can vary. What I learned is that chronic pain is any pain that persists longer than 12 weeks. And that's not to be confused with acute pain, which is the pain in the beginning of an injury. So if I go outside and I roll my ankle off a curb, my ankle hurts. That's acute pain. But if my ankle continues to hurt for months on end, then it's considered chronic pain. I would say the most common form of chronic pain that I see is going to be within the spine. Low back pain, neck pain, mid back pain, and a lot of times then that pain can also translate into hips, shoulders. Anything dealing with the spine is probably what I see the most. Or if I get athletes who had an ACL surgery, then they feel like they're almost conditioned to think that I had my ACL repaired, so sometimes my knee will act up and it hurts. There are also diagnosable conditions that is generalized almost whole body chronic pain. So stuff like fibromyalgia, chronic regional pain syndrome is something that I've seen in people post-injury. Sometimes a lot of autoimmune diseases will come with just general chronic pain within the body. And even if you are someone with one of those conditions, this video can still help you. And let's remember, pain is subjective. So on my body, what I view hurts me is not the same what you view hurts you. Everyone has different tolerances and scales of pain. Pain is not a perfect signal of damage. I know that feels counterintuitive because we are wired to think that pain means something is wrong. And sometimes that is true. Like I said, the acute injuries, the step outside, fall off a curb, roll my ankle, fall on my hand, break my arm, do all that. Yeah, that's gonna hurt. That's acute pain. That's real. But chronic pain operates differently. Pain is an output of your nervous system. Your brain is constantly receiving information from your body every time you touch something or something touches you, and it's making that decision of, does this hurt or does it not hurt? Is this painful? Is it not painful? Is it safe? Is it a threat? Your brain is constantly taking in that information and making those decisions. When you've been in pain for a long time, your nervous system starts to become sensitized to the pain. And what that means is basically your brain will start receiving pain signals at a lower threshold. So it takes less stimulus on your body to feel like you're in pain. This is called central sensitization. And it means you can have significant pain without significant tissue damage. Now, this is not me saying that your pain is all in your head, because trust me, I am somebody who deals with chronic low back pain, and I know it is very real. It is a struggle. I've also treated so many people that have been told that their pain is fake, and it's not. It's very real. When you're in that state of mind, it feels like you can't get out of it. I've literally treated someone who had such a traumatic surgery on their ankle, and their nervous system was so screwed up that even the brush of a feather on their skin made them cry. And I know they're not faking it. It hurts and it feels like I never want to move again. This sucks. Trust me, I get it. I've seen it. But you can get out of it. And it really does start with reframing your mind. I guess what I'm trying to say is the presence of pain doesn't automatically mean you're hurting yourself. And when it comes to training in the gym, that distinction is everything. There's a concept in pain science called fear avoidance. And it's the idea that when we fear pain, we avoid movement. And like I stated before, when you start to avoid movement, it leads to more weakness, more sensitivity, and that in turn can lead to more pain. So it starts to get into this almost toxic cycle, and we have to break that cycle. The way out of the cycle is not to ignore your pain, but learn how to interpret your pain accurately. And that's what the rest of this video is going to do. All right, so let's get into the framework on how we're going to be able to move and feel good, even though we feel like we've been in a state of pain for maybe a year plus at this point. The first piece of this framework is going to be load management. And this is probably the most misunderstood thing when it comes to training when you have some pain. Your body is designed to handle load. And I have to say that again, your body is designed to handle load. And that is why I do not agree with the orthopedic doctors out there who tell people to stop lifting because they have a herniated disc. That's not even practical. What if you're a new mom? You're telling me you're never going to lift your kid? No. Your muscles, your tendons, your joints, they actually need load to stay healthy. And that's not just a fitness principle. That's literally physiology. And when I see people with chronic pain, the problem isn't that they're not loading their body. The problem is that they're either loading their body too fast, or yes, some are not loading at all. Both of those are going to slow down recovery. So what does appropriate load management actually look like? It starts with knowing your baseline. I'm sure most of you have heard of the pain scale. You go to the doctor and they say, tell me your pain on a scale of 0 to 10. When you're dealing with chronic pain, throw out that scale. Kind of, not really. I'm going to teach you how to better use the scale. I'm going to be honest, if you have chronic pain, that scale is very skewed already. Because again, your nervous system threshold has came down. So your version of a 10 is way different than what it was a couple months ago. What I tell people to do is we can still use that scale, but let's not think of it as, oh my gosh, I'm at an 8 today, so I need to rest and do nothing. I will tell people before you start working out, what's your baseline? Like I said, pain is subjective. That number can be very different for everyone. Some might start at a 1 and some might start at a 9. But what is your baseline before we step into the gym? Figure that out first. Then while you're working out, I want you to monitor yourself. We're going to use this scale more as a point system. So let's say I'm walking in the gym and I start at 5. And I start training and you know what? It's a little uncomfortable. So I'm at a 7 right now. That only went up 2 points. We're still in the green. I tell people if you go up 3 points, you're in the green. Once we start to get over 3 points on that pain scale, let's start to check in a little bit more. That's what I call like a yellow zone. So let's not stop. Let's slow down, take a beat, and let's modify the movement we're doing. Put this into perspective. Let's say before I start training, my low back is at a 5. I do some squats. It brings it up to about a 7. Cool. I go into my next exercise. Let's say I do kettlebell swings. And during those swings, I'm at a 9. So I'm not going to stop kettlebell swings. I'm going to change something. I'm going to try to lower the weight. I lower the weight, I'm back to a 7. And I can still continue that movement. And you see how I stepped into the gym, I already was in some pain, but I'm able to still move, but change things to make it less painful but I'm still moving. I'm not sitting at home doing nothing. If you're jumping up on that point scale, I usually say 1 to 3 points, you're in the green. 3 to 5 points, we're in the yellow. Anything over 5 points added to that scale, we're in the red, and we need to stop what we're doing. And just because you're in the red doesn't mean pack up your stuff and go home. It means that exercise just might not be it for that day. Stop the exercise, go onto a different exercise. Now, if you go into a different exercise and it's still red, I still wouldn't tell you to go home. Get your booty to the floor and start doing some stretching and mobility. When it comes to chronic pain, I really try to avoid telling my clients to just go home and rest because they need to move. Now, this process of being able to tell what your baseline is and understand like, okay, I'm feeling a little uncomfortable, but I'm good. It does take some time to be able to know when to, adjust. I will say that typically, if you are someone coming to me who fears movement and you don't move at all, sometimes this process is a little bit easier versus my go hard athletes, because that athlete mentality is so hard to rewire in our brain. I almost find it harder to go through this process with my intense ex-athletes. It does take time. The other piece of load management is understanding that consistency beats intensity every single time. I'm using myself as an example a lot because I've literally gone through this. In high school, I used to squat 3 plates on the side. If I go into the gym and I'm like,
I'm gonna squat what I did in high school,
and I do that, there's a good chance, because I haven't done that in a while, that I might end up actually hurt. And that would be an instance of me going too intense versus me going to the gym every week, starting at a lower weight, and every week trying to slowly raise it. That's consistency. Showing up to the gym 4 days a week at a lower intensity is going to do so much more for your body than showing up 2 days a week and trying to do these all-out ego lifting sessions. And some people might look at that and say, how am I going to get stronger if I'm doing all these low intensity sessions? The thing is, you can get stronger, but your timeline is probably going to look a little different than the person next to you. And that's why you should never compare yourself to somebody else online, but you still can get stronger. It just might be a little bit slower, and that's okay. I touched a little bit on this already, but the second part of this framework would be movement modification. And I want to be very clear about something before I get into this. Modification is not regression. I said what I said. Because I know I've been in a workout class and they're like,
let me modify it for you. And I'm like,
I don't need to modify it. I'm strong. I can do that.
We've all been trained to feel that modification means we're taking the easy way out. No. Modification is smart programming. So if you're in the gym and you're doing a movement, when something hurts, the first question I want you to stop asking yourself is, should I skip this? The first question you should be asking yourself is, how can I adjust this movement? Because almost every movement pattern has a version that's going to work good for you. If you look at something like a basic squat and you take 3 different body types, somebody who's super tall, somebody who's short, somebody who's in between, somebody who has longer femurs, all this stuff. Every single person in that lineup is going to squat differently. It doesn't mean one is squatting wrong and one is squatting better. They are squatting for how their body moves. I think that's important to remember when you're scrolling through gym reels and you're looking at people telling you this is how your form should be. Everybody's anatomy is different. So while there are good general form cues for your physical anatomy in a squat, it might actually be better if you widen your feet a little bit more, or you lean a little forward, or you have a higher chest. Try to change something in the movement to modify it and see if it feels better before you start skipping an exercise. Let's give you some more practical examples here. Let's go with knee pain. A full barbell back squat might hurt your knee, but how can we modify it? You can do a box squat. You can take the barbell away and add dumbbells to your hand, and that's changing the direction of the load. You can try a goblet squat. You can try to elevate your heels. The world is your oyster. There's so many variations of every movement. Let's go with shoulder pain. An overhead barbell press might aggravate your shoulder, but what about a landmine press or a cable press from a lower angle? The pattern of movement is the same. You're still pressing overhead. It's just changing the way you do it. This is also why I stress unilateral work. I do have a 6-week program coming that is 100% unilateral work. And if you don't know what that is, it's basically training one side at a time. A lot of people with chronic pain have asymmetries. So one side is stronger than the other. It's very common. Even people without pain, we all have a strong side and a weak side. So doing unilateral work helps combat that and make sure that your strong side is not taking over for your weak side. I'm talking single leg work, single arm work, all of that. Another modification you can do is manipulating the tempo of what you're doing. Slowing down the lowering phase or the eccentric portion of a movement can actually reduce the stress on your joints because you're putting the load into your muscle versus if you go fast and you do any like bouncing at the bottom, which is not recommended, but it puts a lot of stress on your joints. To sum it all up, the goal is always to find a version of the movement that works for you and not to eliminate the movement entirely. Let's talk about the third piece that I feel like a lot of fitness programs undervalue, but for people dealing with chronic pain, it is super important and a non-negotiable. Recovery has to be treated as part of your training, not separate from it. Let's start with sleep. Sleep has a direct and well-documented relationship with pain. When you're sleep deprived, your pain threshold goes down. And if you're somebody that already has a low pain threshold, we don't want that to go down anymore. Lack of sleep, you'll feel more pain. You might feel it more intensely. And that's not really a mindset thing. That actually is neurological. You need sleep. If you're constantly sleeping 5 or 6 hours a night and you're wondering why your pain is so hard to manage, that's why. Beyond sleep, I want you to think about your nervous system. If you're in chronic pain, your nervous system is in a stress state at all times. I would call it like a low grade stress state. Your nervous system is already working overtime. And if you add aggressive or high intensity training on top of that, yikes. Without intentional recovery, it's like pouring fuel on a fire, baby. No bueno. That is where stuff like breath work or walking or something that even just reduces your anxiety around training can make a real difference of how your body responds. Now, another thing within this recovery framework is mobility. And as a physical therapist and somebody who recently turned 30, mobility is a non-negotiable for everyone I train, myself, non-negotiable. And I'm not talking about stretching because stretching and mobility are two separate things. I'm talking about maintaining joint health and preserving movement variability, keeping your tissues hydrated and well circulated. Mobility should be done every day, ideally. I know I need to do better about doing it every day, but if you take what I call an active rest day, with my clients, there will be mobility on your active rest day, no matter what. People who fear movement, sometimes the mobility days are where we can kind of get over that fear because we are still doing movement, but we're not doing it with weight. I can show my clients, hey, you can do that movement. Overall, recovery needs to be a non-negotiable when you have chronic pain. Make sure you're sleeping, make sure you're doing mobility work, make sure you're doing something to help with anxiety, whether that be breath work, walking, or seeing somebody else for that. Now, before we end this video, I want to talk a little bit about mindset because we can do all this, the load management, reduce stress, blah, blah, blah. But chronic pain really does come down to rewiring our brain. So I want to take a minute and talk a little bit about something that most fitness content will skip over. And it's honestly the reason why a lot of you feel like you're still stuck, even though you're doing everything else right. The psychological component of chronic pain is just as real as the physical one. And I say that not to minimize the physical, but to make sure we're treating your body as a whole. There's a term I mentioned earlier, fear avoidance. And it goes deeper than just skipping workouts. When you've been in pain for so long, your brain starts to categorize movements as threatening, or that movement is the reason that I hurt, or that movement is what caused me tissue damage. So then even when your body has healed, your brain associates that movement with getting hurt. So if you go do the movement, the anticipation of the pain can almost present as pain. You brace, you guard, you hold your breath. You start to approach that movement as if every time I do this movement, something's going to go wrong. And that tension, that hypervigilance actually amplifies your pain response. There's also something called the nocebo effect, which is the opposite of the placebo effect. And it's when negative information makes your symptoms worse. And unfortunately, a lot of people with chronic pain have been receiving negative information. And I'm going to come for my orthopedic doctors here. I'm sorry, I have to do it because as a physical therapist, I am the one that has to fix what you guys have said. I'm not saying every ortho is like this, but with my experience, there is a lot. We go to the doctor and you say, I've had back pain for 5 years, and they do all the imaging because that's what they have to do. That's just insurance, whatever. The ortho or spine surgeon will look at you, and let's say you're 40 years old, and they'll say, you've got
The back of a 70-year-old, you got so many bone spurs, your spine is degenerating. You've got disc out here, there.
and you're sitting there and you're going, oh my gosh, how am I even walking? I should be in more pain. Given all of that information, that language in a doctor's office is so damaging, because there's been so many studies done in pain science of people who get imaging done on their back and people who do not get imaging done, and the difference of pain perception with those two people. I'm going to tell you right now, almost every single person is probably walking around with a bulging disc, but not every single person has pain. It is such a pet peeve of mine when I get people and they tell me, I can't do that. I have a bulging disc. You can do it. The disc is not causing the pain. That's the nocebo. All of this negative information coming to us. And a lot of times that information is coming to us from higher health professionals. So we're almost forced to believe it because we're like, hey, you're a doctor, you're a surgeon. I trust you. Everything that comes out of your mouth, I'm going to believe. Part of the work is rewriting the narratives. Instead of saying my back is fragile and I have to protect it, let's move to my back is adaptable and my back is meant to be loaded. Instead of thinking pain means I'm damaging myself, let's rewire that to pain is information, not always danger. And that shift does not happen overnight. I am well aware. If you've been in pain for years, it takes time. But every positive training experience that you can accumulate is one step closer. Every session where you were able to move and load your body is one step closer. It's evidence that your body is capable of more. And that evidence will build and eventually change everything. Okay, I want to make sure you leave this video with something concrete. So let me give you 4 things you can actually apply starting this week. First is use that pain scale point system that we talked about. Use it every session. Before you train, you check in with yourself, gather a baseline. During that session, you monitor it. And the next morning, pay attention. If your pain is consistently red flag high after a day of training, you probably went a little too intense. The goal is to feel the same, if not better, the next day. The second is to modify before you skip the exercise. If something hurts when you move, ask yourself, how can I adjust it? Change the range of motion, reduce the load, swap the equipment, change the tempo, change something, but do not skip it. The third is to build your baseline before you push. And I see so many people wanting to quickly implement progressive overload, which I totally get because I preach progressive overload. The fitness community preaches progressive overload. That is quite literally how you get stronger. But if you have chronic pain, my main priority is getting a comfortable baseline and getting you moving before we get into that progressive overload. So your first 2 to 4 weeks are about showing up and doing the movement, not necessarily pushing more weight each session. You're establishing a baseline and a tolerance to this movement. And that foundation is key, and we can build off of that foundation. The fourth is to track your flare-ups and not just your lifts. Most people will log their weights and sets, but sometimes they have no idea what actually triggered the pain. Was it a specific movement? Was it too much volume? Was it poor sleep? Was it a stressful day at work? When you start to track your flare-ups, you might realize that your flare-ups might not be coming from the gym, might be coming from some of the other things we talked about. Once you start to see a pattern, you can actually manage it. I want to leave you with this. Your body is not broken. It is adaptable. It responds to what you give it. And if you give it consistent, thoughtful, progressive movement, it will respond. Chronic pain is real. I'm not minimizing that, but I have seen it change, and it can change. I've worked with people who genuinely believe they will never lift again, who are now stronger than they've ever been. And it's not because they found some magic fix, but it's because they learned to work with their body instead of against it. They showed up, they modified what they needed to, they were patient, they were consistent, and things changed. That is what sustainable movement looks like. Not perfect, not necessarily pain-free, but progressive, intentional, consistent. If this video helped you, leave a comment below, especially if you're dealing with a specific type of pain or injury. I read every single one of your comments. So tell me what you're working with and let's keep the conversation going. I will see you in next week's video.